My name is Amy Brown. I'm a clinical psychologist and I work in the Adult Eating Disorder Service.
My name's Sarah Martin. I am team leader for the Community OT in Southwark.
My name's Blodwin Jones, Blod for short. I've been involved in peer support since 2011. I'm also on the Psychological Medicine Advisory Group.
Day to day, I'm providing psychological therapy individually and a group to young people with eating disorders. But I specifically work in an early intervention service, which we developed back in September 2014. So I work with young people who have recently developed their eating disorder, really working to engage them and their families from that early onset to try and prevent the eating disorder becoming hardwired and help them rebuild their lives. When I found out I was shortlisted, I was really touched. It meant a lot to me, especially when I found out it was one of my patients that nominated me. Ultimately, what we're trying to do as psychologists and what I'm trying to do in my work is help these young people, and the fact that someone wanted to recognise me and thank me for that in that way felt really special. One of the most important things is getting to know your patients. Don't make assumptions about them, about what they want from the treatment. Get to know them as an individual and tailor the treatment to their needs so they feel heard and that they're valued, and help them to build up their own identity. I think that's one of the most important things.
As a team, the occupational therapists work on the inpatient wards and they work into the promoting recovery teams in the community in Southwark. Generally, we work with individuals who are struggling with engaging in their everyday lives, struggle with routine, day-to-day routine activities, and perhaps finding things that give them pleasure or give them purpose in their lives, such as work and leisure activities, or particularly to go back to college and to take on training and education if that's what they want to do.
Knowing that they gave me hope and were able to help me transform my own life, and I see that within the team that I work with, working with other service users, and how they instill hope in people and give people some sort of meaning in their lives.
When we found out that we were shortlisted, we were thrilled, absolutely thrilled, because it's a nomination for transforming lives, and that's what I believe that we do, and I'm very proud of that.
I'm a peer supporter. I've been doing that since 2011, and I do the supervision for peer support. I'm also involved in the psychological medicine CAG, and I do all sorts of things through that. I couldn't believe I'd been nominated, never mind shortlisted. I trained as a community and youth worker, and it sort of brings together all my life experiences into a whole. It fits in with the mental health side of things. If I were to talk to somebody about doing what I'm doing, I'd say just be human and remember that we're all human, and that if it happens to us, it can happen to anybody.
I nominated Blod for the award because the time I've known her, she's been very involved in things that I feel strongly about. But I was there from the beginning when she mentioned wanting to work with the police to try to reduce the stress on mental health service users. When I first met her, I was asking how long she's been out of the wards. She said 15 years, so I said, how did she manage that? And she told me by being involved in projects, anything that would improve the life of service users. So I took that on board, and I've been out of hospital since then. So she's transformed my life.
If I won the award, I would be totally silent, I think, for once in my life, because I'm not normally a quiet person. I just love what I'm doing. I found my niche in life.